Thank you for coming, everybody. My name is Lukus Zuker, and I am with Community Outreach Team through the Senior Linkage Line at the Metropolitan Area Agency on Aging. I will talk a little bit more about those agencies towards the end. The topic of today is preventing Medicare fraud and avoiding scams. And what we're going to cover today is a bit of an overview of what is Medicare fraud, healthcare fraud, what it is, who participates in it, who it impacts, and then identify some ways to detect it and prevent it. After that, we're going to move on to avoiding scams, talk about some of the leading or current scams that are affecting people these days, and obtain some tips on how to stay safe and avoid those scams. And then I'm going to leave you with some helpful resources, some different agencies to report scams to or to find some information. I will talk a little bit more about the Senior Linkage Line and the agency I'm with. Preventing Medicare fraud. I want to emphasize at this point that when I say Medicare fraud, I'm not talking about just the big headline cases that you might hear about. For instance, I read, this was last year in 2018, I read this article in the Washington Post about a doctor in Texas, and he was accused of $240 million in Medicare fraud over the course of like 10 years. But the total that they're coming after him for is $240 million. And and it was for excessive billing and unwarranted procedures and things like that. And apparently he had a Maserati, a private jet, 3 homes, and a pair of penthouses in Mexico. So those ones really catch our attention. They're in the headlines, but really fraud happens everywhere, every day. And that's kind of the lesson that I would like to leave people with is let's be smart about being on the lookout for it. So what is it? What is Medicare fraud? So Medicare fraud is knowingly and willfully. Those are the 2 key words. Knowingly and willfully executing or attempting to execute a scheme or ploy intending to defraud Medicare of money. It could be billing for services or supplies that were not provided. It could be billing twice for the same item. As I understand, that one happens quite a bit. Billing separately for services that should have been included in a single service fee or bundled together as one charge, and instead they broke it up into multiple charges. Or concerning like medical equipment, maybe you rent some equipment and then return it, and they continue to bill for a couple days after that. That one is kind of a sneaky one because you know in your records that you returned it and you assumed that that was the last day. And then maybe only later, or maybe you never find out that they continue to bill Medicare after you returned it. So again, keep in mind that the knowingly and willfully are the 2 keywords there. And really it comes in different degrees of, I call it misuse. On one end, we have errors. That could be billing mistakes. Every type of service or lab that you get at a medical office has a code to it. And there's a person in the billing office who types in all these codes, so you were seen at this date, at this time with this doctor for this code. And it's just a simple slip up, and now maybe your annual Medicare visit was billed as an MRI, like a $10,000 MRI. That's a big deal, but it wasn't intentional. Waste is kind of the next one, and that's more or less being inefficient. It could be excessive office visits. It could be ordering excessive lab tests that maybe aren't going to tell the doctor much, but just to rule things out. Could be writing excessive prescriptions, those kinds of inefficiencies. By the time we get to abuse, it's a little bit more bending the rules. It could be billing for a brand name drug when generics are actually given at the pharmacy. It could be charging for services or supplies in excess of what the actual cost is. It could be kind of, they call it upcoding or unbundling. So it's, it should have been that one code and instead it was kind of broken up without the intention of fraud, but just the person is there and sees all these things and doesn't realize that should be one code. By the time we get to fraud, this is where intent comes in, because now it's intentional deception of the Medicare system, knowing that the actions are wrong and illegal, and still the doctor, the provider, the medical supply company goes about doing that. So those are kind of the spectrum of Medicare misuse. So why is this important? Fraud and abuse and waste cost taxpayers billions of dollars every year. With an increasingly aging population, there's also an increase in the number of people with Medicare. For those of you who do not know, 10,000 people every day reach age 65 in the United States. And we're not even to the top of the baby boom wave yet. And still, it's 10,000 people a day. So with that, there's just a lot of pressure. There's a lot of people who are using this system, and we need to make it efficient and last as long as possible so that everyone gets their benefits. When people were asked about fraud, 37% of Americans age 62 to 75 ranked fear of fraud ahead of other things like a health crisis or terrorism. 85% of people said that they would be more likely to report fraud and abuse if they knew more about it. And that's kind of what I'm here today, is to tell you what it is and leave you with some resources to report it. So first of all, how do we detect it? The primary way is through that Medicare summary notice that you might get every quarter, every 3 months in the mail. It might also be an explanation of benefits that you get from your health plan. And this includes all of the charges that were made on your behalf at a hospital, at a doctor, at a specialist, at a lab work for a clinic, medical supply company, prescriptions. All of that is going to be in here. And a lot of people, I think, see it and it says, this is not a bill at the top, and they say, oh, good, and they toss it. And really, this is your chance to go over it with a fine-tooth comb and see, does it seem accurate? Are there charges there that stand out, that don't really seem like something you received? A nice way to do this is to keep a health journal or a healthcare calendar where you can put, on this date, I saw Dr. So-and-so, he did such and such procedure and such lab work. Or I returned medical supply equipment to this company on this date. And that way, when you get your notice, you can review it. So bills from the hospital you can review, the insurance claims, the summary notice from Medicare itself, and just make sure everything lines up. That's kind of the first line of defense. This is the website for Medicare. The official government site for Medicare is medicare.gov, and there is a wealth of information on this website. You can find health and drug plans and compare them. You can find out what the different parts of Medicare cover, how to file a claim or an appeal, and you can report Medicare fraud and abuse right through this website. Another thing, in this corner, you see mymedicare.gov login. By clicking there, it brings you to this website, mymedicare.gov. And what this is an online Medicare account where you set up an account with your own password and your Medicare number, and then you can access your Medicare information anytime. So instead of waiting 3 months to get that notice from Medicare with a whole list of bills in your name, you can log in and get that just like that. The idea here is that if people are checking this online, they're more apt to remember what some of those different office visits were like, and what lab work did the doctor order that day, and things like that, so that people can spot these errors quicker and report them quicker. So that is an option through mymedicare.gov. So what can you do to prevent Medicare fraud? The first and foremost, the biggest thing you can possibly do is guard your Medicare number and your Medicare card. Medicare had this whole advertising campaign called Guard Your Card with videos and little advertising clips. This is really the biggest thing you can do. And think of it like a credit card number. So you wouldn't give that to just anyone over the phone or anyone at a health fair or an expo. Same thing for your Medicare number. When you are, at a public place, or if it's somebody who you don't know is going to be providing you a direct service, you might not want to give it to them. So it's different if you're going to a doctor or a clinic or an emergency room. That's different. But if it's somebody just sort of stopping by your door and saying they have some diabetic testing supplies that no charge to you, that's a red flag. So why do scammers love Medicare cards? And I will note that this is the old Medicare card. I will show the new Medicare card in the next slide. Why did scammers love these old Medicare cards? Because there's a lot of information on them, a whole bunch. So not only do we have your name, but previously the Medicare number was your Social Security number followed by a letter. And scammers knew that. So if they got a hold of your summary notice that you threw in the trash, they know that that is a Social Security number. They also know your signature, and if they are kind of wise to how Medicare works, they could assume your date of birth, or at least be pretty close by knowing that the effective date is probably the month and the year you turned 65. And piecing that together, it's not just billing Medicare fraudulently in your name. Once somebody has your birth date and your Social Security number, now it's identity theft, financial fraud, opening a bank account, buying a house in your name. So that is one of the reasons why in 2015 Congress passed a law that said that Medicare numbers need to be modernized and be more secure. And that's where we have the new Medicare cards. For Minnesotans, it tended to be starting last July, I think it was. From now on, new people to Medicare are getting these cards, and everyone who already had the old card should have gotten a new card by now. So again, we do still have your name, but the Medicare number is now sort of a randomly generated number and letter system. Some people have pointed out that it's harder to remember, so that is a downside. But if this fell out of your pocket or you left it at a doctor's office, the only thing somebody would be able to do would be to bill Medicare in your name, which is still not good, but they would not have your Social Security number to open a bank account or buy a house. So that's a huge benefit to this new card. I will note too, in this example, it kind of shows it, there are certain letters that they do not use in the new cards because they could be confused with numbers. So S, L, O, I, B, and Z are not included in the new Medicare cards. And I have had people talk about, I got my new card, but I can't tell if that's a 0 or an O. It's not an O, it is a 0. The other thing to be suspicious of are doctors, providers, suppliers who say things like, oh, it's not going to cost you anything. Medicare will pay for it. Or, oh, we just need it for our records. That's a lot of trust there. If somebody says that, that you get something and maybe you don't have the documentation that says that you medically need it, that's an issue. Especially be suspicious if somebody calls or visits saying that they represent Medicare. So Medicare and all federal agencies will never call you out of the blue or stop by your door. The federal government always communicates by mail. So if you get something in the mail that says it's from Medicare, that's different. But if somebody calls and says, I need to verify your Medicare information, hang up. That is not the real thing. If somebody uses high pressure or scare tactics, we are all independent people and we have the ability to investigate and research things before we make a move about something. So if somebody tries to say, oh, you need to do this today or you're going to miss out, no. Generally speaking, there are not such high pressure timelines for that. If somebody offers non-medical transportation or housekeeping as a Medicare approved services, that is something that Medicare does not pay for. So think about that. Same thing for a wheelchair or scooter. Medicare does provide that, but there are very specific qualifications, and you would have to have the medical documents from a doctor that says that you require that. So if somebody sees an advertisement on TV about get a scooter today, we will bill Medicare, no cost to you, it sounds too good to be true because it is. And likewise, if somebody is in a nursing home, that kind of changes things in terms of how things are billed. If somebody wants to bill you for medical equipment, if that person is in a nursing home, talk to the administration at the nursing home about that. Also, this Medicare and healthcare fraud, it crosses over into the health insurance company side of things. So if somebody calls you up and says, oh, you got to switch your plan today. Switching plans is a must. Be wary of that. During that transition from the old Medicare cards to the new Medicare cards, we were hearing reports of people scamming people through that confusion, where people would call and say, your Medicare card is changing, I just need to verify your current Medicare number. And what they want is your Social Security number. Additionally, some people were calling and saying, claiming to be from Medicare and saying, would you like your new card? There is a small charge for that. Can we have your bank account information? No charge for the new card. And Medicare is never going to call you. Something like, for you, a special price. Yeah, that's not how healthcare should work. There are set prices, and that kind of salesmanship is not honest. Health fair scams is one that kind of irritates me a bit because I vend at a lot of these health expos and fairs. And if there's ever a free prize or a raffle drawing that requires you to fill in a card, just be wary. If it asks for a Medicare number, please do not give that Medicare number. Who knows who gets that Medicare number down the road. It's one thing to enter a raffle with your phone number and your name. That's different. But if it's requiring some additional information, yep, there is no legitimate reason to include that type of information for a raffle. And be wary of phony organizations. And this one gets tricky because there are some organizations out there that might have an official sounding name. It might sound like something that really does exist. And I will get more on that in just a moment, but keep that in mind too. These graphics here are showing little bits of the web address line on a computer browser. And what I want to point out is that we have a locked padlock and we have an HTTPS, and that S is for secure. So this is a really good thing to note when you are browsing the internet. If you go to Social Security Administration, ssa.gov, it's automatically going to show up as a secure connection. And that is your way of knowing that, when you transmit information, private information on that website, it's going to be safe on its journey. Versus a news website or a clothing store, it might not be secure until you get to a checkout, like an online checkout. But if you're just receiving information, like on a news website, not such a big deal. But if you go to a bank website, you want to make sure it's S for secure and the padlock. Same thing for Medicare.gov, is also a padlock and an S, always. So just to repeat, remember that Medicare does not call or visit in person to sell you anything. Medicare is not in the market of selling anything. They're just a repository of information, and they can connect you to people who can help advise or counsel you on your options, but they are not going to pressure you to buy anything. Remember that you cannot enroll over the phone unless you initiate the call. So again, if there's an insurance company calling up and saying, oh, there's changes coming to your plan, and this did happen last fall in Minnesota, where many people were losing their Medicare cost plan. And with that confusion, there is this opportunity for scammers to call and make it sound like your plan is ending, we need to do this now. Let me enroll you over the phone. And it's different if you initiate the call. Be especially leery if somebody calls asking for a bank account number. There is no legitimate reason for that. It would be different if it was paying a bill, with a check and sending it off. And remember that if Medicare needs to contact you, they will mail you a letter. So in terms of reporting Medicare fraud, the first kind of step in your action is to call the provider in question and try to resolve that issue. Because it could be an honest billing mistake, and they can say, oh, I'm sorry, I need to resubmit that bill to Medicare under the correct code. Done. You did your part. Thank you for your part. If, however, you're unable to resolve that issue, or you get sort of a runaround where somebody says, oh, that really didn't, Medicare paid it, why do you care? That's a red flag. That tells you that somebody is intentionally getting money for something that you did not receive. So what you can do is you can call 1-800-MEDICARE. Also on the Medicare.gov website, there is a page about fraud. You can call the senior linkage line and we can advise on how to report. And then there is also the Office of the Inspector General, who has a fraud hotline, and that is the direct number for the fraud hotline with Medicare. So what would you need to report? You would need to have the provider's name, the service or the item that you're questioning, and the date it was supposedly given or delivered, the approved amount, and all of this is on the summary notice that you're looking at. The approved amount that was paid by Medicare, the date on that summary notice, of course your name and Medicare number, and the reason why you think Medicare should not have been paid. And here's the good news, is there is a service, they call it the Incentive Reward Program, where there's an opportunity to actually get money, like a reward for reporting Medicare fraud if Medicare investigates and is able to recoup some money. You get 10% up to $1,000 of the money that Medicare is able to recoup. So that's a really nice incentive to kind of look at your summary notice, pay attention to things, compare it to your health journal or health care calendar, and just be on the lookout. Moving on then to other scams. If some of these relate to you or a family member or a friend, by all means, I would love to hear your experiences, because I think a lot of us have had at least some of these happen to us. Here is an unfortunate statistic, is that while seniors age 65 and older make up 11% of the population, they represent 30% of scam victims. So why is this the case? They are more likely to have a nest egg and have some retirement savings, some property that they own, some investments. And when you add up the retirement and investments of seniors in the United States, it ends up being $30 trillion. So that's just a glowing beacon saying, you know, let's try to see if we can get some money out of these older people. And I got that from the Minnesota Department of Commerce, and they do a fraud presentation as well. Older adults are from a generation that was raised to be trusting and polite. There's a term for this called being a courtesy victim, where maybe somebody is kind of talking on the phone, trying to sell you something or get some information, and you're just too polite to hang up. I've been there. I thought I won a cruise, and it went on for 20 minutes before I realized, oh, this isn't real. And then I was embarrassed, but I did, I ended it. There is unfortunately shame after being scammed or not knowing how to report it. So that's something to keep in mind. And older adults tend to be more interested too in different products that promise increased cognitive performance, virility, physical condition, things like that. So there's kind of that side of scams too in terms of fraudulent products. And I will touch on that in just a moment. So in terms of some top scams that do target seniors, the healthcare, Medicare, and insurance fraud. One that I really didn't touch on though, related to that, would be somebody misusing a Medicare number or card for somebody else, like to actually get healthcare. And that is absolutely still part of Medicare fraud, because it's somebody who is not entitled to that benefit using somebody else's benefit. So that is just as bad. And leads to some of its own issues, because now maybe there's a medical record with certain diagnoses in your name, and now you're going to the doctor and they're assuming that that is you and it wasn't you. So that's not good. Counterfeit prescription drugs is a scam that has been identified. And with the cost of prescription drugs, it's really no question that people do look for lower costing options. And that could be a Canadian pharmacy, it could be an online pharmacy that gets drugs from Mexico. You need to be careful about that. You never know what you're going to get unless it is properly obtained from a pharmacy. So it might be tempting, but keep that in mind, that you really don't have a quality assurance when it's something from an online pharmacy, especially if they don't require a prescription. Some of them don't require a prescription. That is to be suspect. Funeral and cemetery scams. This is kind of a heartbreaking one, where there are reported scams of people who will read an obituary, find out that somebody has died, and then call the family and claim that the recently departed owes them money, owes a debt, and then harass the family in their time of mourning and grieving to pay them this money. So that's kind of one twist on it. Somebody, when I was giving this presentation, also pointed out that she had heard of the same kind of idea where a scammer is looking at the obituary, sees the time and date of the funeral, and then goes to the house and robs the house, which again, just breaks my heart that that would ever happen, but something to think about. That particular attendee at the presentation recommended having a particular family member stay at the house and not go to the service at the church or a gravesite, just to kind of be a security measure for that. Fraudulent anti-aging products. There are products out there that might look or sound like a legitimate product, but for 1/10 of the price, and there's probably a reason why that price is so incredibly low. And you kind of get what you pay for some of those things. And then for telemarketing, I think for a lot of people, this is where we have most of our exposure to scams. And it's, on one hand, it's the easiest to just not answer the phone and screen your calls, or to answer your call and it's a recording, a robocall, and you hang up. But the downside to that is, by you answering, that actually tells the scammer that, yep, that is a legitimate number, because they can call upwards of, let's say, dozens of numbers all at once. And when somebody picks up, it says, oh, that's an actual number with an actual person who actually answers their phone. And that number gets saved in a list. And then that list gets sold to somebody else. So this is all the more reason to screen your calls. A lot of people who have caller ID will just not answer their phones. And if it's a number they recognize, they'll pick it up. And if not, you let the voicemail or the answering machine do the work. The IRS scam. This is one that unfortunately does meet success in terms of people losing money. I have heard of people losing money to this. And this is the one, if you have not heard of it, where somebody calls and claims to be from the IRS and says that you owe back taxes, and let's say $10,000 in back taxes, and the sheriff has been notified and he is on his way, and you need to go and wire money to this account in the next 2 hours, or you are going to be arrested. And people panic. Nobody wants to be under investigation by the IRS. So instead of thinking, wait, why is the IRS calling me? People panic and they go and wire the money. And that is unfortunately a rather common one. Keep in mind that the IRS, as a federal agency, is never going to call. If you actually owed back taxes, I can imagine you're going to get a notice, and then probably another notice, and then another notice in the mail. And it may also use strong language, but it's not going to be an emergency situation over the phone. The Pigeon drop is one that I was actually nearly scammed on. And this involves something where I was selling something online, and somebody expressed interest and said, okay, I'm going to send you a money order, and then got back to me and said, oh, my secretary made the money order out for $250 more than our agreed upon price. So when my friend comes to pick up the item that you're selling, give him the extra $250. And I said no. And it never arrived. But that idea of somebody giving you something, and then while you cash that money order, you don't know that it's fake. And then there's some overage that you give cash for, and then by the time the bank realizes that that is fake, you are out the money that you gave over. That's the Pigeon drop scheme. Fake accident ploy. This, again, it kind of plays on our emotions, where somebody would call and say, this loved one of yours is in a hospital, and we have some bills and we need some funds for the ambulance or whatever it might be. And people get panicky and they give over the money. And I should mention that a lot of these different scams will either use a wiring service, so go to Western Union and send money to this account, which cannot be recouped. Once it is gone, that money is gone. Another way that they will do it is they will say, go to this store and buy gift cards or Visa prepaid cards. And again, once you give the number that you scratch off on the back of those, that money is gone. It cannot be traced. So if anybody ever calls and wants you to send money via gift cards, there is a reason why they're not using legitimate means for money. Think of it that way. Charity scams, they pry at our giving nature and our empathy, and it could be something where after a natural disaster this tends to happen, where there are a lot of different groups that pop up that might have Hurricane Katrina Help.com. And you think, oh, I want to help the people of Hurricane Katrina. And then it's questionable as to how legitimate that is. If it was a natural disaster, there are, honest and vetted charities out there that you can give money to. Same thing too, if there's a name that might sound like something legit. I have an example here of something like the National Arthritis Foundation. Oh, it sounds really, really good. And that doesn't exist. It's just called Arthritis Foundation. It's not the National Arthritis Foundation. So keep that in mind. They can deliberately make things sound official. So for internet fraud and Windows scam, this could be, and I've received this one over the phone too on my cell phone, where somebody calls and claims they are from Windows and they have detected a virus on your computer. And what they will do is people get panicky. Oh, Windows, they must know that I have a virus on my computer. And then they will ask you to do certain things so they can have access to your computer. And chances are they're actually going to put a virus on it when they have access and then hold it ransom. Similar to that would be like an internet virus, where maybe you see a pop-up on your screen and you think, and it might say, virus, warning, click here to remove virus. And that is the ploy. By clicking here to download this antivirus software, you're actually inviting the virus into your computer, and then who knows what happens to it. It very well might be sort of ransomed, where they will say, send money to this account and we will unlock your computer. That happens, unfortunately. So just keep that in mind. Same thing goes for opening email attachments from somebody you don't know. If it's some random person with some random attachment in an email, don't open it. Only open attachments from people you know. Investment schemes, I think this plays on a lot of our inexperience with financial products and how investments work. We do trust our brokers, our financial planners with a lot, and it's most of them I think are honest, but there are ways that we can vet our financial planners, and I will leave you with a tool at the end about that. For homeowner or reverse mortgage scams, one example of this is, and I have actually received this in the mail too, where it looks like an official letter from the county assessor, and it's not. It's from a company who is asking to provide an assessment of your property for a cost. They want you to utilize their service, and they will charge you for their service for something that the county would do for free anyways. And then reverse mortgage, it is a legitimate thing if you know what you're getting into and you're educated about what it means. There are some people that will sort of talk people into them and not give them the full information, and the next thing you know, you're in sort of a tight situation. For sweepstakes and lottery scams, I think most of us have heard about this one, where you might get an email, a phone call saying, you've won the Jamaican lottery. And you think, great, how do I get the money? And they say, oh, well, you just have to pay taxes and a small fee. Same idea like the Pigeon drop, where they're going to tell you the check's in the mail, just wire that taxes and fee to this account. That is no good. Additionally, I learned from the Minnesota Department of Commerce that you are not supposed to play a foreign lottery in the first place. So even if you had just been in Jamaica the week before and now you get a call about winning the lottery, even if you did win, you're not supposed to do that as an American citizen, win foreign earnings from a lottery. The grandparent scam is something that I have heard many seniors in the metro here talking about, where they will get a call that says, Grandma, it's me, Lukus. Or I'm sorry, perhaps they won't even use a name. Grandma, it's me. And then you might say, Lukus, is that you? Yeah, it's me, Lukus. And then they will say that there is some emergency, they're stuck in another country, they were going, and it can be elaborate. It could be they're in a hospital, it could be they're in jail, they were mugged while they were in a foreign country, but they need some money, and oh, I'm so embarrassed, please don't tell mom and dad, but wire the money to me so I can get back home. And I have heard of people actually going as far as to the bank and getting money for this one. So that is kind of a sad one. The precious metal schemes, these would be kind of unscrupulous, valuable metal companies that might say, you know, top dollar for your gold. And well, for one, is it actually? What are they going by? Are they going by the actual market rate, or are they undercutting it by a lot? And if you are sending your money to if you're sending your valuable metals in an envelope to some random post office box, you have no indication that you're actually going to get paid for that. So just be leery of that. If you do want to sell some old rings or jewelry, you can go to a local store, and they are regulated for just that purpose. Romance scams is again kind of a sad one, but I feel like this is a growing one, and it utilizes social media. So people are on social media, they are meeting people, and they might develop a friendship, and that might even grow and into a sort of trusting relationship. And the next thing you know, the person says, oh, you know, my loved one is in the hospital, I don't know what I'm going to do, I don't have any money. And maybe you wire them some money. Or they say, oh, I would so love to come visit you, but I don't have cash for the airplane ticket. You wire them some money. And who knows if they're even who they say they are. And that's the difficult thing with online relationships. And you've built up this trust. They may have used photos, they may have used stories to kind of develop a rapport, but there's no guarantee that that person is who they say they are, or that those crises are what they say they are. And then lastly, for home repair, this one is a tricky one because sometimes people will stop by with kind of a too good to be true deal. Oh, I'm in your neighborhood today repaving people's driveways. You know, my crew is just down the road. Can we repave your driveway since we're here? Sounds like a windfall, sounds excellent. But you didn't request that service. You didn't vet them. You don't know how the quality is going to be. You don't know if the price is even sort of accurate and on point. And they might even say, oh, you know, just pay 50% now, and then we'll bill you later. And that kind of high pressure thing where you think, oh, I'm getting a deal here. But the point is that you didn't have time to actually do some research and actually think, do you really need your asphalt repaved or your roof redone? So just be wary of that kind of a scheme. Now, I did mention the sort of obituary scam. Similar to that, though, is a funeral or a cemetery scam. And the average cost of a funeral is a lot of money, $7,000 and up, much higher than that even. And federal law does have requirements that a funeral home is required to provide you with these three costs. All goods and services offered, so that could be the ceremony, the embalming, all of that, the cost of the casket, and the cost of the grave liner, also known as an outer burial chamber. And the thing to keep in mind is that if you get the casket elsewhere, they are not required to charge you extra. That's not supposed to be the case. Same thing if you are going to be directly cremated, there is no law that says that you need to be embalmed. So that itself could be a savings. They very well might say, oh, well, you need to have a casket to be cremated. And that's not the case. You just need some type of a container to hold the body, and it could be It could be a very basic pine wood container. It need not be a $3,000 casket. So it kind of plays on our emotions during that time when you're grieving, and there are all these different expenses for flowers and food and renting a hall or renting a choir or some music, and the next thing you know, here are some additional prices that maybe you didn't have time to really think about in that state of mind. Concerning some fraudulent anti-aging products, again, anything that claims to do some wondrous thing about reversing the aging process or increasing vitality, look at that with some suspicion. I have had this happen to me when I was a teenager with the free trials that you would see on TV, but they required a credit card, and the next thing you know, they were sending you reoccurring charges. I think that happens quite a bit. Be especially leery of fake Botox. People have died from this. Small strip mall kind of businesses that might say discount Botox, and you go there, and Botox is a brand name product, and if it is not actually that brand name product, you have no idea what is in it, and people have died from that. If something says that it does have an active ingredient, just like the much more expensive brand name product, it might very well be the 20th ingredient down on the list, and it's not strong enough to actually be active at that point. If it's the same product but at a much different price, there's probably a reason for that. Beyond just branding, there very well could be a substantial difference in the product. So if it sounds too good to be true, it probably is. Here are some tips and resources. Just in general, be leery of answering the door if it's somebody that you don't recognize or are not expecting. I don't want people to be overly fearful about interacting with neighbors and surveys and things like that, but just trust but verify who you are interacting with. Same thing for the phone. If you don't recognize the number, it's easy to just screen the calls, let the answering machine or the voicemail do the work. If somebody needs to reach you, they will leave a message. You can sign up for the National Do Not Call Registry. I have heard that that's kind of a mixed success, the Do Not Call Registry. Part of it is because when somebody sends out robocalls, it goes out to 100 different numbers, and they have a way of shielding their ID and making it look like it's from a local number. I've even heard people who get calls and the caller ID is their own number. That's an example of that kind of shadowing or phantom telephone ID. So that's kind of a mixed success. If you do come across fraud, be it over the phone, in the mail, in person, you can report it to the Department of Commerce. They have a whole team of investigators who look into fraud. You can opt out of junk mail through the Direct Marketing Association website. I find it a little insulting that they require a fee so that you don't get junk mail, but if that's something that interests you. And then this is a great tool if you want to make sure that your investor or your financial broker is licensed and not being under investigation or red flagged by the government. You can go to finra.org broker check or investor.gov, and you can actually put in the name of your broker, and it will say, are they licensed? Are they under investigation? And I went to these websites just the other day, and they are all still open and working. We trust our financial advisors with so much, and if that is our nest egg, we want to make sure that they have our best interest in mind. One of the things that some financial brokers will do is they might call you up and say, oh, your money isn't making as much money as it should. Maybe we need to transfer it to this other type of fund or this other type of account. But every time they do that, they might be taking a fee, a percentage fee. And if they're moving your money and you're trusting them to have your best interest in mind, and if they don't have your best interest in mind and they are doing that simply to take a cut every time they transfer it to another type of product, that is not a good thing. You're losing money. So a little bit about who I am with. I'm with the Metropolitan Area Agency on Aging, and we are a nonprofit. We're located in Arden Hills. We serve the 7-county metro here in Minnesota, And our mission is to assist individuals to age successfully and develop the capacity of communities to care for an aging population. We are one of 7 of these area agencies on aging in Minnesota, and one of over 600 across the country. So this came about as part of the Older Americans Act, and every state has these nonprofit area agencies on aging to help people age successfully and live well in their communities. Part of what we do is partner with the Minnesota Board on Aging to deliver the Senior Linkage Line. So the Senior Linkage Line is a statewide information and assistance service. It is for older adults, caregivers, professionals who work with older adults, as well as people with disabilities can call us up and we link them to providers and services in their area. We are also the designated state health insurance assistance program for Minnesota, and that is a federal requirement that says that we are able to counsel people on their Medicare options, where we are not insurance brokers. We don't get any kickback. We have no contracts with insurance companies, but we are able to talk about all the different options and find the right plan for the right person and provide that as a free service. Our hours are Monday through Friday, 8 a.m. till 4:30 p.m. But of course, you can call outside of that window and leave a voicemail, and someone will follow up with you. So the goals of the Senior Linkage Line: connecting people to resources in the community by providing accurate, helpful information, and by discussing service and benefit options. So sometimes people will call us and they have a very specific thing in mind. I am looking for home delivered meals in Minnetonka. Okay, so we can look that up and tell you the providers in your area. Sometimes people call us with a specific issue of, I got this bill and I don't think it's right, and what should I do? And we can kind of talk through options. We can make referrals to other agencies or state offices as well. It's about keeping people informed and independent. Some of the help that is available, about half of our calls tend to be Medicare and health insurance related, but there's all kinds of things that people call us about. Housing in their area, that's a big thing of what we do. Transportation is a big one. And we're able to filter the results too. So if somebody is receiving county assistance, medical assistance, or a waiver from the county, we can filter the results so we're only looking at providers that are able to accept that as payment. Same thing if maybe you do not qualify for those programs, but you want to find a donation-only kind of service or a sliding fee where it's based on your income, we can filter it by that as well. So things like home repair, chore services in the home, caregiver supports, all kinds of things people call us about at the Senior Linkage Line. Now related to that is this website called MinnesotaHelp.info. And this is a state website of the state of Minnesota, and it's similar to the Senior Linkage Line in that it shares the same database of information of providers. So where some people like to call the Senior Linkage Line and speak to somebody who navigates through those options, you can also go to this website 24 hours a day, 7 days a week, and you can type in a keyword and type in your zip code and then search. And it will find and list the providers arranged by distance away from your zip code. And it's actually more than 10,000 different providers now. It's something like 12,000, and something like 43,000 different services are listed in this. It is across the entire state of Minnesota, the resources that are within it, and it is not just for seniors. So there are resources in there for people with disabilities, for young people, for families, for unemployed people. And here we have some of those popular topics. So if you did not know what you're looking for and just wanted to see what are some topics that seniors tend to look up, you could browse that way as well and click on seniors and then see some of the different topics and the subtopics under each of those. So that's a nice way to just see what's available in your area. How old do you have to be a senior? In Minnesota, it tends to depend on what you're talking about. So for Medicare, it tends to be 65 and older. For housing, sometimes it's 60, sometimes 62. Just keep in mind that even with the Senior Linkage Line, with senior in the name, people call us who are caregivers of somebody. People call us who might have a disability and have Medicare due to that disability. So there is no cut and dry age, is kind of the short answer. I will leave you with a rule of thumb. When in doubt, don't give it out. Regarding your private information, your Medicare number, your bank account, your birth date, and if you do get something that might sound legitimate, maybe your bank calls you or your credit card company calls you. Instead of just verifying some information, you might want to just hang up, look at the back of the card and call them. That's a nice, easy reassurance of, if there is indeed something that they need to verify, well, now you've made the effort and you called a number that is legitimate on a card and not relying on who knows who it is, shadowing who knows what number. So keep that in mind. When in doubt, don't give it out. Well, I hope I have left you with some good tools to be a little bit cautious in terms of who you trust and who you give information to. Thank you.